1. The Black Death, Bubonic Plague. The Black Death, caused by the bacterium Yersinia pestis, is one of the deadliest pandemics in human history. It swept through Europe, Asia, and North Africa in the 14th century, killing an estimated 25 to 50 million people. This was roughly 1/3 of Europe's population at the time. The disease was primarily transmitted through fleas that infested rats, which were common in medieval towns and ships. Once humans were bitten by infected fleas, the bacteria spread rapidly, causing symptoms like swollen lymph nodes, buboes, fever, chills, and death within days. The disease also had a pneumonic form, which spread through respiratory droplets, making it even more contagious. The Black Death caused widespread panic and social collapse. Entire villages were abandoned, economies crumbled, and people turned to religion, superstition, or violence to explain the catastrophe. Some groups, like Jews, were wrongly blamed and persecuted. The pandemic changed Europe forever, leading to significant economic and social transformations, including labor shortages that weakened feudal systems. The Black Death reminds us of the devastating impact of infectious diseases and the importance of understanding and controlling outbreaks. Advances in medicine and public health have reduced its threat, but it remains a symbol of how fragile societies can be in the face of pandemics. 2. Smallpox. Smallpox was a highly contagious and deadly viral disease that plagued humanity for thousands of years before being eradicated in 1980 through a global vaccination campaign led by the World Health Organization, WHO. Caused by the variola virus, smallpox killed hundreds of millions and left survivors with severe scars, or possibly a way of life in the neighborhood. Thus, smallpox killed hundreds of millions and left survivors with severe scars and blindness. Symptoms began with fever, fatigue, and body aches, followed by a rash that turned into fluid-filled pustules. These pustules would crust over and scab, leaving scars. Smallpox spread through close contact and contaminated objects, making it difficult to control in densely populated areas. The disease significantly influenced history. Native populations in the Americas were decimated after Europeans introduced smallpox during colonization. Smallpox outbreaks shaped wars, politics, and royal lineages, as rulers and armies succumbed to its grip. The eradication of smallpox is one of humanity's greatest public health achievements, showing the power of vaccines and international cooperation. It serves as a reminder of what can be accomplished when nations work together to fight disease.
Click subscribe to this channel to get more topics you love.
3. Spanish flu, 1918. Influenza pandemic. The Spanish flu pandemic of 1918-1919 was one of the deadliest in history, infecting 1/3 of the world's population and killing an estimated 50 million people. Unlike typical influenza outbreaks, this pandemic disproportionately affected young, healthy adults, alongside the elderly and very young. The disease was caused by the Hunanan influenza virus. It spread rapidly due to global movement during World War I, as soldiers and refugees carried the virus across continents. Symptoms included fever, fatigue, and severe respiratory issues. In severe cases, patients developed pneumonia and died within days. The Spanish flu overwhelmed healthcare systems, with makeshift hospitals and mass graves becoming common. Public health measures like mask mandates and quarantines were implemented, but the lack of antibiotics to treat secondary infections and the limited understanding of viruses hindered efforts to control the pandemic. The Spanish flu taught the world valuable lessons about pandemic preparedness and the importance of transparent communication during health crises. Its legacy lives on in modern flu research and public health policies. 4. HIV/AIDS. HIV/AIDS is a global epidemic that has caused millions of deaths since it emerged in the late 20th century. HIV, human immunodeficiency virus, attacks the immune system, weakening the body's defenses and leading to AIDS, acquired immunodeficiency syndrome, if untreated. HIV spreads through contact with infected blood, semen, vaginal fluids, or breast milk. It disproportionately affects marginalized communities, highlighting the intersection of health, stigma, and social inequality. Early in the epidemic, many countries responded with fear and discrimination, further isolating those living with the disease. Modern antiretroviral therapies have transformed HIV/AIDS from a death sentence into a manageable chronic condition, allowing people to live longer, healthier lives. Education, prevention, and global health initiatives have significantly reduced transmission rates, but challenges remain, particularly in regions with limited health care access. HIV/AIDS underscores the importance of science, education, and compassion in fighting stigma and improving global health. It is a story of resilience, innovation, and the ongoing quest for a cure. 5. COVID-19. COVID-19, caused by the SARS-CoV-2 virus, is the most significant global pandemic of the 21st century. Emerging in late 2019 in Wuhan, China, the disease spread rapidly worldwide, causing millions of deaths and disrupting economies, healthcare systems, and daily life. COVID-19 primarily spreads through respiratory droplets, with symptoms ranging from mild COVID, pinches, fever, cough, fatigue, to severe difficulty breathing, organ failure. The virus posed unique challenges due to its ability to spread asymptomatically and its impact on older adults and those with pre-existing conditions. Governments implemented measures like lockdowns, mask mandates, and vaccination campaigns to control the virus. Scientists developed vaccines at unprecedented speed, showcasing the power of global collaboration and medical innovation. However, misinformation, vaccine hesitancy, and unequal distribution of resources complicated efforts to end the pandemic. COVID-19 revealed vulnerabilities in global health systems and highlighted the importance of preparedness, trust in science, and international cooperation. It serves as a reminder of how interconnected the world is and how shared challenges require collective solutions. 6. Malaria. Malaria is one of the oldest and deadliest diseases, primarily affecting tropical and subtropical regions. It is caused by parasites of the Plasmodium genus, transmitted through the bites of infected female Anopheles mosquitoes. Each year, malaria infects hundreds of millions and kills over 600,000, with children under 5 being particularly vulnerable. Symptoms include fever, chills, headache, and severe complications like organ failure if untreated. Malaria thrives in regions with warm climates, stagnant water, and limited access to healthcare. Poverty exacerbates its spread, as many affected communities lack resources for prevention or treatment. Efforts to combat malaria include insecticide-treated bed nets, anti-malarial medications, and mosquito control programs. Recent breakthroughs, such as the first malaria vaccine, offer hope for reducing the disease's toll. However, challenges like drug resistance and environmental changes continue to hinder progress. Dryads. Literally, everything moves at the speed of the law. Malaria highlights the need for equity in healthcare and the importance of sustained efforts to fight preventable diseases. It is a reminder of how science, innovation, and community action can save lives in the world's most vulnerable regions. 7. Cholera. Cholera is a waterborne bacterial disease caused by Vibrio cholerae, which infects the small intestine. It has caused devastating pandemics throughout history, leading to millions of deaths, particularly in regions with poor sanitation and limited access to clean water. The disease spreads through contaminated water or food, especially in overcrowded or disaster-stricken areas where hygiene is compromised. Cholera causes severe diarrhea, vomiting, and dehydration, which can lead to death within hours if untreated. Its rapid onset and high mortality make it particularly feared. Cholera outbreaks have shaped history, including during the 19th century, when 6 global pandemics claimed countless lives. The disease also drove advancements in public health, as scientists like John Snow discovered its link to contaminated water, laying the groundwork for modern epidemiology. Today, cholera remains a significant global health threat, particularly in developing countries. Vaccines, improved sanitation, and access to clean water have drastically reduced its impact in many regions. However, climate change, natural disasters, and ongoing poverty continue to fuel outbreaks. Cholera serves as a stark reminder of the importance of clean water, sanitation, and public health infrastructure in preventing disease and protecting communities. 8. Tuberculosis, TB. Tuberculosis, TB, is a bacterial infection caused by Mycobacterium tuberculosis that primarily affects the lungs. It has been a leading cause of death for centuries and remains a major global health challenge, particularly in developing countries. TB spreads through the air when an infected person coughs or sneezes, making it highly contagious in crowded or poorly ventilated spaces. Symptoms include a persistent cough, chest pain, weight loss, fever, and night sweats. In its latent form, TB can remain dormant for years, only becoming active when the immune system weakens. During the Industrial Revolution, TB was called the White Plague, due to its widespread prevalence in urban centers. Antibiotics introduced in the mid-20th century revolutionized TB treatment, but drug-resistant strains have emerged, complicating eradication efforts. Today, TB is curable with proper medication, but millions still lack access to treatment. Co-infection with HIV further exacerbates the problem, as immunocompromised individuals are particularly vulnerable. TB underscores the need for equitable healthcare and the ongoing fight against infectious diseases. It highlights the role of science, policy, and education in controlling global epidemics. 9. Ebola virus disease. Ebola is a viral hemorrhagic fever caused by the Ebola virus, first identified in 1976 near the Ebola River in the Democratic Republic of Congo. Known for its high mortality rate, ranging from 25% to 90%, Ebola is one of the deadliest diseases in the world, not to mention one of the most infertile. Ebola spreads through direct contact with bodily fluids of infected individuals or contaminated surfaces. Symptoms begin with fever, headache, and muscle pain, progressing to severe vomiting, diarrhea, and internal and external bleeding. These symptoms, combined with its rapid progression, make the disease both terrifying and highly lethal. Ebola outbreaks have devastated communities, particularly in West Africa. The 2014-2016 epidemic was the largest, killing over 100,000 people and overwhelming healthcare systems. The disease also spreads fear and stigma, often leading to mistrust of medical professionals and resistance to public health measures. Recent advancements, including vaccines and improved treatments, have significantly improved survival rates and containment efforts. However, challenges like limited healthcare infrastructure and misinformation persist, especially in rural areas. Ebola teaches us the importance of preparedness, community engagement, and global collaboration in combating emerging infectious diseases. 10. Yellow fever. Yellow fever is a viral disease transmitted by infected Aedes and Haemococcus mosquitoes. It is most prevalent in tropical regions of Africa and South America, where it has caused devastating outbreaks for centuries. The disease gets its name from one of its symptoms, jaundice, which causes the skin and eyes to turn yellow. Yellow fever progresses in two phases. The initial phase includes fever, headache, and muscle pain. In severe cases, the disease enters a toxic phase, causing liver and kidney failure, internal bleeding, and death. Without treatment, mortality rates in severe cases can reach 50%. The COVID-19 cause of yellow fever is more frequently due to this condition and needs greater charity and protection. Historically, yellow fever has shaped global events. During the construction of the Panama Canal, outbreaks among workers delayed progress and caused widespread suffering. The disease also affected trade and travel, leading to quarantine measures in port cities. The development of a highly effective vaccine in the 20th century has drastically reduced the impact of yellow fever. Vaccination campaigns combined with mosquito control efforts have significantly curtailed outbreaks. However, challenges remain in ensuring widespread vaccine access, particularly in underserved regions. Yellow fever is a reminder of the interconnectedness of human health, the environment, and global mobility. It underscores the importance of vaccines and proactive public health measures in saving lives. 11. Polio, poliomyelitis. Polio, caused by the polio virus, is a crippling and potentially deadly disease that primarily affects children under 5. It spreads through contaminated water or food and attacks the nervous system, sometimes leading to paralysis and permanent disability. During the mid-20th century, polio outbreaks caused widespread fear, with thousands of children paralyzed annually. The development of the polio vaccine by Jonas Salk in 1955 marked a turning point, leading to widespread immunization campaigns that drastically reduced cases worldwide. Today, polio has been eradicated in most parts of the world thanks to global vaccination efforts. However, a few regions, particularly in Afghanistan and Pakistan, still face challenges due to conflict, misinformation, and vaccine resistance. Polio's near eradication highlights the power of vaccines and global cooperation. It serves as a beacon of hope for the fight against other preventable diseases. Syphilis. Syphilis is a sexually transmitted bacterial infection caused by Treponema pallidum. Known as the Great Imitator, syphilis can mimic other diseases, making it difficult to diagnose in its early stages. Left untreated, it progresses through 4 stages: primary, secondary, latent, and tertiary, with devastating consequences in its final stages. Historically, syphilis caused widespread suffering, particularly before the discovery of antibiotics. In the 19th and early 20th centuries, it was a major public health crisis, affecting millions worldwide. The disease was also stigmatized, with infected individuals often ostracized or hidden away. The advent of penicillin in the mid-20th century revolutionized syphilis treatment, making it easily curable if caught early. However, syphilis has seen a resurgence in recent years, particularly among marginalized communities, underscoring the need for ongoing public health efforts. Syphilis reminds us of the importance of sexual health education, early detection, and equitable access to healthcare in preventing the spread of infectious diseases. 13. Measles. Measles is one of the most contagious viral diseases in human history, caused by the measles virus. Before the development of a vaccine, measles caused millions of deaths annually, particularly in children. It spreads through respiratory droplets, making it extremely easy to contract in crowded or poorly ventilated spaces. The initial symptoms include fever, cough, runny nose, and red eyes, followed by a rash that spreads across the body. In severe cases, measles can lead to complications such as pneumonia, encephalitis, brain inflammation, and even death. Children, pregnant women, and immune-compromised individuals are particularly vulnerable to these complications. As I've said, physical observation is vital to identify early signs upon the development of the disease. Measles was a leading cause of childhood mortality until the introduction of the vaccine in the 1960s. Widespread immunization campaigns drastically reduced cases and deaths worldwide. However, vaccine hesitancy and misinformation have led to a resurgence in outbreaks, even in countries where measles was previously eliminated. Measles serves as a reminder of the importance of vaccination in protecting public health. It highlights how quickly preventable diseases can return when immunization rates decline, emphasizing the need for global efforts to maintain herd immunity. 14. Cancer. Cancer is not a single disease, but a group of related conditions where abnormal cells grow uncontrollably, invading surrounding tissues or spreading to other parts of the body. It is one of the leading causes of death worldwide, responsible for millions of fatalities annually. Cancer can affect almost any part of the body and has many types, including lung, breast, colon, and prostate cancer. Risk factors include genetic predisposition, lifestyle choices like smoking or poor diet, and environmental exposures to carcinogens such as radiation or chemicals. Early symptoms vary widely, but can include unexplained weight loss. Treatment options depend on the type and stage of cancer and may include surgery, chemotherapy, radiation therapy, or newer approaches like immunotherapy and targeted drugs. Advances in early detection and treatment have significantly improved survival rates for many types of cancer, but disparities in access to care remain a challenge. Cancer underscores the importance of prevention, early detection, and innovation in medical research. It also highlights the resilience of those who face this disease and the collective efforts needed to fight it. 15. Heart disease. Heart disease is the leading cause of death globally, encompassing a range of conditions such as heart attacks, strokes, and coronary artery disease. It primarily affects the cardiovascular system, where blood vessels become narrowed or blocked, producing blood flow to vital organs. Risk factors for heart disease include high blood pressure, high cholesterol, smoking, obesity, physical inactivity, and diabetes. Lifestyle choices play a significant role, but genetic predisposition can also contribute. Symptoms vary depending on the condition, but may include chest pain, shortness of breath, and fatigue. Modern medicine has made significant strides in managing heart disease, with treatments like medications, surgical interventions such as stents or bypass surgery, and lifestyle modifications. Preventive measures such as a healthy diet, regular exercise, and routine health screenings are critical in reducing the risk of developing heart disease.